Welcome to our video on the innovative use of artificial ligament substitutes with polypropylene mesh to enhance hip joint capsule stability in orthopedic oncology. Hip joint instability can lead to significant pain and mobility issues. Traditional methods often fall short in providing long-term stability following resection of proximal femur tumor and joint replacement surgery. Combining an artificial ligament substitute with a durable polypropylene mesh provides enhanced support and promotes better integration with the body's tissues. This method mimics the natural ligament, ensuring improved stability and function. The procedure involves resection of proximal femur tumor and insertion of megaprosthesis joint replacement implant. This is followed by implanting the artificial ligament substitute and securing it with polypropylene mesh to the hip joint capsule. The mesh and ligament are wrapped around the proximal femur megaprosthesis. This mesh and ligament duo acts as a scaffold, promoting tissue growth and reinforcing the joint. This advanced technique not only restores stability but also reduces recovery time, offering patients a quicker return to their daily activities. Thanks for watching the video.